Welcome back. Here's an interesting statistic for you. More kids miss school because of asthma than for any other illness. And recognizing the symptoms can be an important part of getting proper diagnosis and treatment. Today, we welcome Dr. Jamshed Kanga, a pediatric pulmonologist at Kentucky Children's Hospital, and also Development Officer Laurelyn Cecil with a look at a special program that can help manage asthma in children. Thank you both so much for being with us today. Well, it's a huge problem nationwide to see asthma, right?
It is, and it is increasing. The prevalence of asthma in children and adults is increasing, and I think we probably have the highest rate of cancer, of lung cancer, but also of asthma in the nation.
And there are a couple of reasons of things that we know in Kentucky are medical issues or lifestyle choices that contribute to our high rate of asthma.
Well, I think smoking, being one of the highest number of smokers in the nation, certainly doesn't help our asthma statistics.
And one of the things that we were talking about during the break is how important it is to recognize asthma. It may be confusing to some to realize that their child has asthma. What are some of the symptoms they should look out for?
I think especially in children, people always associate asthma with wheezing, asthma with having attacks. But probably the most common symptom of asthma in any age group is recurrent and persistent episodes of coughing. So if your child continues to cough, most of the time, the diagnosis is bronchitis and the child is treated with antibiotics. But really, that is the inflammation in the airways that's causing the cough. So any unexplained persistent cough in a child, or even in an adult, should make one suspicious of asthma.
And you mentioned the smoking. You brought here a pretty visual example of what smoking can do to you.
Well, we carry this around to some of the fairs that we hold in the state to try and explain to people how important it is to not smoke. I mean, as a pediatrician, for me, of course, the big problem is that these children are exposed to passive smoking, and it causes all sorts of respiratory problems, including asthma. But for the adult patients who do smoke, or of course I'm sure there are some teenagers that smoke, to know what's going into their lungs, and this is the amount of tar that goes in the lungs of a half a pack a day smoker in a year. And you can imagine we have people who smoke 2 and 3 packs of cigarettes a day. And you can imagine the end of the year, their lungs are filled with tar.
That really puts that into perspective.
And it does. And I think we have a picture here that shows that when you do autopsies on people who are smokers versus non-smokers, you can actually see that the lining of the lung has become black. And then, of course, this is a specimen of lung cancer, where the top part is now eaten away with cancer. So it is a very important problem in our state, and we continue to fight against smoking.
And one big tool in that fight, I know a special partnership between Kohl's and the Kentucky Children's Hospital. Tell us a little more about that.
That's right. Kohl's, the department store, gives a grant annually to the Children's Hospital. It's been about $100,000 this year and for several years. And we use that money to go across the state and let people know. We bring the jar of tar, but we also bring all kinds of aids to help people understand what triggers asthma and to discourage people from smoking, because that's the #1 contributor.
And that program is available in several counties throughout our area.
It is, actually. We were in Ashland earlier this year. We're going to be in Owensboro this year, too. So we travel across the state. There's also a media campaign, so people will see it even if we're not at a fair in their state.
Well, some wonderful information, and again, on such an important topic that affects a lot of Kentuckians. Thank you both so much for being with us.
Thank you for inviting us.
And we have the phone number and website at the bottom of your screen if you're interested in learning more on the asthma program from Kentucky Children's Hospital, and also a phone number there where you can get more information. Thank you both so much.
Thank you.
We will be right back with a check of your Thanksgiving week forecast. Stay with us.